we've had a lot of questions about how the public can participate. Julie, I know there's some open meetings, and I think we have a slide with some of those dates. So if you could talk a little bit about what the public process is with PPG moving forward, that would be great.
Sure. So there's the comment forum that's already available on the Engage website for the county. So each of the 4 areas that the PPG group is particularly looking at, we're asking for comment on those. And just as a note on how kind of those groups were formed is that of the 15 members of our team, and if you look at the group membership, there's clearly a wide variety of expertise. They identified the subgroup that was going to fit best with their expertise, and we did that through a survey process and got those groups together, and then we had chairs nominated from those groups. So what those teams are intended for is to then really guide the process in each of those 4 areas as we move over the next couple months. So for community engagement, there will be at least one open session for each of those groups where we're going to have national experts come in, present on some best practices or some next practices, as Marcia talked about, and have that available for community feedback and input. Also, each of the groups will be designing or identifying where they may need to get additional community feedback. And then we'll be working, whether it's through focus groups, additional survey work, potential additional open forums over the next several months to get that feedback. Our end goal is to be able to take the assessment work that Marcia and her team are doing and combine it with the community engagement work that the PPG group is doing to present a set of recommendations to the county manager by the middle of December. And so the group is not itself implementing any change and doesn't have decision-making authority on any change. What we are doing is trying to get the community feedback, the best information possible, the data, qualitative and quantitative from the assessment, to come up with a set of recommendations that then county leadership would then take up in a different kind of decision-making process in the spring. The Monday, September 14th, the group will be looking at policing and mental health, and I think Naomi's done a nice job of describing what that project is really trying to think about what our alternatives are to the current response to people that are in mental health crisis. And we're talking about alternative dispute resolution, including both mediation, restorative justice, and other potential diversion pathways other than traditional criminal justice pathways. October 12th, Rodney's group is leading the conversation about civilian review board. And the question for that group is not whether or not there will be one, but what the format is of that group. And I think, as he indicated, what level of authority they have. Compared it to, in a variety of different ways, what level of legal authority they have. So that question is really about the models. And so we'll be looking at some different models for doing that. And then October 26th, we're going to be looking at traffic and policing. And at that point, as Allison had indicated, we're going to have data back from the assessment to look at where we might have any discrepancies over representation of particular groups in traffic stops or other kinds of data. And then also thinking about what are alternatives. Traffic stops are a high risk moment for police. What are alternatives to doing traffic enforcement that would potentially decrease some of those high risk encounters? So those are the 4 that we have set for right now. There will be additional opportunities for interaction on these topics, and they'll be coming out and on the PPG website as they're scheduled. And we'll be working with different stakeholder groups that are relevant to make sure that the word gets out on those.
So there's a question about, what's the final deliverable of the group? What happens after December when the PPG group wraps up? And who ultimately will be drawing the conclusions of the work of the group? So Mark, maybe that's all rolled up for you.
Yeah, I also wanted to address another point, which is that we're not waiting until the group finishes. If we actually come across practices which we find something that's really not working very well, we have a lot of discretion right now, as at least I do as managing a department, to make some changes that we think make sense. What's going to happen is the report is going to come to me, and I think there'll be a number of recommendations that I'll say will fall more on the administrative side, and we'll just go ahead and make those changes. Ones that deal with policy decisions and funding decisions, because a lot of this is going to turn around funding. those will be included in proposals that make their way to the county board for conversation as part of the budget. So that's some broad outlines on it, and we're going to learn a lot as we go along. We'll see how it all goes.
Thanks, Mark. You know, I just want to do a lightning round of everyone. You know, what do you hope that will come out of the PPG? You know, you're all passionate about this work, and what would success look like? So who wants to start? Marcia.
I'd like to see some sterling new practices that somebody hasn't attempted come out of Arlington, that they become a model for some other parts of the country to follow.
Thank you. Julie?
Success for me would be really active community engagement in this process and feeling like we've done a really good, effective job of reaching across different elements of the community that don't always participate in public processes, so that we know that we've got those voices heard.
Allison, we'll go to you.
Sure. Success for me would be really taking an honest look at the information that we're going to get and being able to make concrete recommendations to improve the level of service that the police department is providing for the county.
Thank you. Naomi?
Certainly, I want to have recommendations for the police to better treat people with brain diseases, which is what people with mental illness are. There's no other illness where police are the first responder. That's got to change. But I hope for far more than that. I hope that we have mobile crisis. I hope we have early intervention. I hope we have hospital care that keeps the person until they're stable, and to others in the community that can help them maintain their stability. There's a whole continuum of care that I hope this will be the stimulus for. Thanks.
Thank you. Devanshi?
I hope we have an opportunity to empower the community with information that it needs to understand police practices and to understand the justice system as a whole. And in particular, with regard to alternative practices, I hope that we as a community are able to embrace the data and the information necessary to be able to utilize the system in a manner in which it's meant to be utilized, but divert cases and address some of our social justice issues appropriately by diverting cases away that don't necessarily need to be there.
Thank you very much. Rodney?
Thank you. I will echo a lot of what statements were made prior to mine. But first of all, I think success will be broad community engagement on an issue that can be somewhat divisive. We heard some of that earlier today about whether, we think the police are fine, nothing should be changed. Others say, hey, there needs to be profound change. And our subcommittee work basically can encourage conflict. I understand that. Subcommittee understands that. Success for me would be being able to walk that tightrope where we can have community engagement, recommend a process that the community believes can help improve their participation in policing in the sense of they have a voice to express their concerns, and the police department feels that they're not being put upon too much. There will be some give and take on both sides, but success will be coming up with a positive step forward, or a positive way forward that both sides, to put it that way, can live with and go forward with.